As part of our continuing commitment to honesty and transparency, today, Andrea Dwyer, President and CEO of Sagepoint Senior Living Services, is addressing some questions that have come up recently about Sagepoint's day-to-day operations, especially since mid-March. This is the first of what will be a series of informational videos designed to keep you updated about developments here at Sagepoint. Some have said that PPE was not given to staff in a timely manner. Can you address this question?
Our staff received PPE in a timely manner. We distributed PPE well before we even had a known positive COVID client in our facility. We would never do anything to put our staff at risk. They are our biggest human resource, and we recognize the value that they bring to the table. Our PPE was distributed well before this, and staff were trained in proper techniques to don and doff PPE and to conserve PPE per CDC guidance.
On that topic, there was a report with a former employee who stated that she did not have proper equipment when she was last in the building on March 30th. Can you answer this?
That is correct. The employee was last in the building on March 30th, which was prior to us having a known COVID client in our facility. So PPE was distributed once we knew we were accepting a return long-term care client back to us that was COVID positive, at which point prior to that, all PPE was distributed and education was provided to the staff that remained with us.
Can you address the question regarding staff testing at Sagepoint?
Sagepoint completed testing universally, which means we tested every resident in our building. This allowed us to go ahead and put residents in proper placement for their safety and the safety of our staff. We are one of only 1% of the facilities in the state of Maryland that has accomplished this task.
Can you address the question regarding staff testing at Sagepoint?
Staff at Sagepoint were given CDC guidance. They were advised to follow up with their primary care physician and a lab of their choice in order to let us know their results and their physician's recommendations.
Do you believe staffing levels at Sagepoint are adequate to handle the number of residents you currently have?
Staffing levels at Sagepoint remain adequate. Clients can be comfortable in knowing that they will always receive the high level of medical oversight that they have come to know from Sagepoint.
What mechanisms has Sagepoint put into place to communicate with families, and when did those start?
Sagepoint started communicating with our families around COVID-19 on March 6th. Since then, we have done 12 updates to our website, which are readily available and viewable by anybody. Communication and transparency with our families has always been a point of pride with Sagepoint. Further, after receiving test results from our universal testing, Sagepoint quickly began making calls to every family member to keep them abreast of their loved one's well-being. We know this is a difficult time for family members with their inability to come in and see their own loved ones. This has been a priority for Sagepoint, and we have made sure that we have dedicated nursing staff to make these calls every day to every family, Monday through Friday.
There were reports earlier this week that the state of Maryland strike team was called to respond to Sagepoint last Monday. Can you shed some light on that?
Sagepoint received no strike team. We did, by contrast, have a group of nurses from Health and Human Services come in. They made some really helpful suggestions about how we can make staff feel more comfortable working in this environment. They were an absolute pleasure to work with.
Thank you for watching this first informational video. If you have questions that you'd like us to answer in future videos, please send them to questions@sagepointcare.org. We will do our best to get in as many as we can. Remember, stay in, stay safe, and we'll get through this pandemic together.